Hello everyone, my name is Brianna Sanchez and I will be discussing abuse in the foster care system. Imagine this. Under the watch of the Oregon Department of Human Services, a lawsuit alleges a young sister and brother were starved so severely by their foster parents and guardians that they weighed the same at ages 4 and 5 as they did at ages 1 and 2. A caseworker saw the children less than a month before doctors at Randall Children's Hospital determined they were suffering from chronic starvation, but the caseworker did nothing. One study by Johns Hopkins University found that the rate of sexual abuse within the foster care system is more than 4 times as high as in the general population. In group homes, the rate of sexual abuse is more than 28 times that of the general population. These children were placed in the foster care system to be in a safer place than they were before, not to be abused. According to a Time magazine article, foster care is intended to protect children from neglect and abuse at the hands of parents and other family members. Yet all too often it becomes an equally cruel form of neglect and abuse by the state. The same children that are suffering from these issues could also be suffering from issues that result from these traumas or will in the future. According to a credible source, while some children who are exposed to domestic violence in the home show no greater problems in adulthood than those who are not exposed, many other children can suffer lifelong consequences. Some problems associated with childhood exposure to domestic violence include higher levels of aggression, poor social relationships, lower cognitive functioning, belief in rigid gender stereotypes, and increased tolerance for and use of violence in adult relationships. Studies further indicate that children who are exposed to domestic violence in their homes are at an increased risk of experiencing neglect or abuse themselves. With the children that grow up in these terrible environments, that terrible environment becomes a big part of their life. Being abused is basically how they're raised, and it's something that they know very well. A boy named Terry experienced some of this and more in his lifetime. He entered foster care at the age of 1 after he was found with his 5 siblings suffering from frostbite in an unheated home, his mother in a drug-induced sleep. When he was 5, he and 2 of his siblings were adopted by a foster family. Unfortunately, things went downhill from there for him. Terry and his siblings had to be removed from their new home due to an extreme abuse and neglect, after the subsequent death and abuse of his 5-year-old adoptive brother. Thereafter followed a sequence of 16 placements, during which Terry began to exhibit increasingly serious behavioral problems. By the time he turned 11, Terry was placed in a residential facility where he began making suicidal comments, saying that he wanted to go to heaven to be with his deceased adoptive brother. He left the facility during severe thunderstorms without any shoes on. When he was found, he had to be hospitalized for over a month. He has since been diagnosed as suffering from the psychological effects of the extreme abuse and neglect he suffered while in various placements, complicated by a lack of permanence over his 10 years in government custody. The child welfare system responsible for Terry has since been held in contempt for failing to comply with a court-ordered consent decree, and has created an internal receivership to help move toward compliance, thanks to the efforts of the private advocacy group Children's Rights, Inc. For Terry, there came a happy ending. He has recently been adopted by a warm and stable family, but it took years of difficult and costly litigation to bring about this result. According to Child Welfare Outcomes, a consistent finding of the Child Welfare Outcomes reports is that, although states are fairly successful in achieving placement stability for children in foster care for less than 12 months, the percentage of children who have placement stability declines considerably the longer the children are in foster care. It is promising, however, that states have demonstrated improvement in achieving placement setting stability for children in care longer than 12 months. So they're getting better at finding permanent homes for children who are being abused, which definitely helps with the long-term effects of abuse and the fact that they're being abused at all. Statistics regarding to children in foster care who are victims of maltreatment by a foster parent or facility member say that in 2010, 0.32% were victims. In 2011, 0.28% were victims. In 2012, 0.27% were victims. In 2013, 0.34% were victims. And in 2014, 0.5% were victims. The statistics may be low, but they are still there.